What we're looking at right now is the humerus. But to help you orient yourself whenever you look at this bone, the first thing we're going to do is have a look at both the top and the bottom structure that is on the list in your little booklets. So the head, for example, is going to tell you which is the medial side of the bone. So that is what this bit is on this end. And that is used in the shoulder when you go with the scapula. That's that joint will occur there, and that's what gives us so much movement because it's a ball and socket joint, which you would have learnt about, and that gives us so much movement in the shoulder. So if we'll just remove the scapula, so the head of the humerus is always going to be on the medial side. So if I rotate it around, we know that this is where the head is here, so that's going to be the medial side of the bone. In terms of knowing what is the posterior view and what is the anterior view, what you have to have a look for is there is this deep hole in here. And that's the bottom structure that we've asked you to look for, the olecranon fossa. Because what that is this is the groove where the olecranon process will come and move into when you're extending your elbow. So it's a really deep hole. There is a small one on the other side, but if you can see that really large deep hole there, that's going to tell you that you're looking at the posterior part of the humerus. So those two orienting factors, the head being medial, and then that groove being the posterior side of the humerus. Next, what we want to have a look at is the medial and lateral condyles, epicondyles. So that word epi, if you remember from when we were learning about the skin, tends to mean on the outside. So our epicondyles are going to be on the outside at the bottom of the humerus. In terms of which one is medial and lateral, well, you can have a look to see where the head of the humerus is, and that's over here. So this is going to be our medial epicondyle, and this one is going to be our lateral epicondyle. Now moving on to the lateral edge up here, when you're having a look at it in class, you can see that there's sort of a roughened side of the bone, and that is our deltoid tuberosity. So when we've got the muscle attachment, it's going to be attaching over the top here, and the deltoid will feed in to the side of it. That's a little bit of a bow that you can see quite well actually in this video, and that's your deltoid tuberosity. Just beneath it, we'll skip down one, is the radial groove, and that is easier seen on the posterior side, but it's a groove that's running around the outside of the bone, just forming that radial groove. We also have the greater tubercle. So if you think of the word greater, you think above and better than. So it's going to be sitting at the top of the humerus. And if the head, so that nice smooth surface is on this side, on the other side, so the lateral side, we've got the greater tubercle. So you can see just an extra little bump happening on the other side there. Then our last two are once again at the base. We've got a couple of different shapes once we have a look down here. So we'll just rotate the bone around a little bit so that we can see it. Okay, so we've got some better shading there. You've got a rounded portion, and then you've got a bit where it's sort of a groove in between. And what these are where the bones of the forearm are going to articulate. So for our rounded bit, that is our capitulum. So if I go and grab our radius bone, which we'll learn about more in another video, that is going to attach to the capitulum and allow the radius to rotate on that rounded edge there. Whereas next to it, we've got the trochlea, and that's got that groove in the center bit here, because that is where our ulna is going to fit into and actually rotate through that space. So when you've got these bones in class, have a play. So the radius is going to go onto the capitulum, and then the ulna is going to go onto the trochlea, and that's where those articulations are going to take place.